Hi, you may never have heard of this, or you may experience this yourself and feel relieved to know you're not alone in feeling like this. So let's talk about morning depression. Is it real? Does it exist? Do you ever wake up in the morning feeling just terrible? You want to crawl back into bed and pull the covers over your head? This is called morning depression, but does it really exist? And if so, should you be worried? Morning depression, sometimes known as morning blues or PMDD, is a mood disorder that only occurs in the morning hours after waking up. Keep watching to find out all about morning depression, what causes it, the signs to look out for, and how to treat it. It was first described by psychiatrist Abraham Lowe in 1967. People who experience morning depression feel sad, anxious, empty, or hopeless when they wake up in the morning. They may not want to get out of bed because they don't feel motivated or energized. They may also have difficulty concentrating or making decisions. In some cases, people with morning depression may even feel suicidal. It is important to note that morning depression is not the same as having a bad morning or feeling sleepy after waking up. Bad moods can happen to anyone from time to time, but morning depression is a more serious condition that can have a significant impact on a person's life. If you are struggling with morning depression, it is important to seek professional help. Now let's take a look at what causes this problem. One possible cause is low levels of serotonin. Serotonin is a neurotransmitter that plays a role in regulating mood, sleep, and appetite. When serotonin levels are low, people may feel depressed, anxious, or even suicidal. Another possible cause of morning depression is an imbalance of other neurotransmitters, such as dopamine and norepinephrine. These neurotransmitters also play a role in regulating mood and motivation. An imbalance of these neurotransmitters can lead to feelings of sadness, apathy, and lack of pleasure. In addition to chemical imbalances, it can also be caused by environmental factors. For example, people who live in areas with little sunlight may be more likely to experience morning depression because sunlight helps regulate the body's internal clock, which controls sleep-wake cycles. People whose sleep has been disrupted for any reason may also be more likely to experience this problem. This could be due to an underlying sleep disorder such as insomnia or sleep apnea. It could simply be the result of not getting enough sleep on a regular basis. Certain medications can also contribute to morning depression as a side effect. These include antidepressants, antipsychotics, and sleeping pills. Another potential cause of morning depression is a lack of exercise. Exercise has been shown to have a number of mental health benefits, including reducing symptoms of depression and anxiety. Therefore, people who do not exercise regularly may be more likely to experience this type of depression. It can also be caused by a stressful event or situation. This could be anything from financial problems to relationship issues to work-related stress. This could manifest as a deep sadness, hopelessness, or emptiness. People who experience morning depression may also feel anxious or agitated. These are some of the signs and symptoms, one of them being very low and empty feeling on waking. They may have difficulty concentrating or making decisions. In addition, people with morning depression often have low energy. They may feel tired, fatigued, or lack the motivation to do anything. This can make it difficult to get out of bed in the morning and start the day. Other common symptoms include social withdrawal, changes in sleep patterns, and difficulty controlling emotions. If you think you may be experiencing morning depression, it is important to speak to a mental health professional so they can help you identify the underlying cause and develop a treatment plan. As we mentioned earlier, there is no single test that can be used to diagnose morning depression. Instead, a mental health professional will typically use a combination of methods to make a diagnosis. This includes taking a detailed history of your symptoms, performing a physical exam to rule out any underlying medical conditions that could be contributing to your symptoms, and conducting psychological testing to assess your mood and cognitive function. If you are diagnosed with morning depression, there are several treatments that can be helpful. Psychotherapy is often recommended as a first-line treatment for this. This type of therapy can help you identify and change negative thought patterns that may be contributing. In addition, psychotherapy can help you develop coping mechanisms for dealing with stress and anxiety. In some cases, medication may also be recommended as a treatment. Sleeping tablets, antidepressants, mood stabilizers can be helpful for some. However, it is important to note that medication is not always necessary or effective in treating morning depression. Lifestyle changes can also be an effective way of managing it as well, so take a look at your lifestyle and see what could be changed. Getting regular exercise, eating a healthy diet, and getting enough sleep are all important for maintaining good mental health. In addition, practicing relaxation techniques such as deep breathing exercises or yoga can help reduce stress and anxiety. Now we'll discuss whether or not morning depression is something you should be worried about. The answer is yes and no. If left untreated, it can worsen over time and lead to more severe mental health problems. On the other hand, though, many people who experience this recover fully with the right treatment, so don't worry too much. Instead, focus on taking care of yourself and getting the help you need. Here are some things you can do to take care of yourself if you have morning depression. First, try to get plenty of rest. Aim for 7 to 8 hours of sleep each night. If you have trouble sleeping, talk to your doctor. Second, eat a healthy diet. Avoid caffeine and alcohol, and eat plenty of fruits, vegetables, and whole grains. Third, exercise regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Fourth, practice relaxation techniques. This could include deep breathing exercises, yoga, meditation, or spending time in nature. Finally, reach out for support. Talk to a trusted friend or family member about what you're going through. You can also join a support group or talk to a therapist. Remember, you don't have to go through this alone. There is help available and recovery is possible. Here are some additional tips that may help you cope with morning depression. Get up at the same time every day, even on weekends. This will help regulate your body's internal clock. Let in some natural light as soon as you wake up. Sunlight helps regulate the production of serotonin, which can improve your mood. Make sure your bedroom is dark, quiet, and cool. This will create a conducive environment for sleep. Avoid using screens before bedtime. The blue light emitted from screens can interfere with the production of melatonin, which is a hormone that promotes sleep. Write down your thoughts and feelings in a journal. This can help you process your emotions and identify any negative thought patterns that may be contributing to your depression. Reward yourself for your accomplishments, no matter how small they may seem. This will help you stay motivated and build momentum towards feeling better. Be patient with yourself. It takes time to feel better. Don't get discouraged if you have setbacks. Just keep moving forward one day at a time. We hope you found this video helpful. If you have any concerns about your mental health, please don't hesitate to reach out to a qualified mental health provider. Thanks for watching.